Welcome to this explainer where we're breaking down the AGLS Clinical Dermatology and Practice short course and really looking at how it can completely transform your daily clinical practice. Look, if you're a frontline healthcare professional, you already know the skin is the body's largest organ, right? It's usually the very first indicator that something is off. But let's be honest, skin conditions can be incredibly tricky to pin down. So today, we're going to see exactly how this specific program equips you with the tools to handle these cases with absolute confidence.
Let's take a quick look at our roadmap. We'll start with the dermatology training gap, and then look at the AGLS Dermatology Solution. From there, we'll cover foundations in pharmacology, managing common skin conditions, and tackling complex cases and specialties. Finally, we'll wrap up with how this advances your clinical career.
All right, let's jump right into Section 1, the dermatology training gap.
So ask yourself, as a frontline healthcare professional, how often do you encounter a complex rash and just wish you had more specialized training to treat it right then and there, rather than delaying care with a referral? It happens literally all the time, doesn't it? A patient walks into the clinic or the pharmacy, they've got a highly irritated, completely unidentifiable skin lesion, and you're stuck. You're forced to choose between prescribing a generic topical cream that might not even work or sending them to a specialist they might not be able to see for weeks.
And that perfectly highlights the core problem here. Billions of people suffer from skin diseases worldwide. It's actually one of the most common reasons patients even seek healthcare in the first place. Yet frontline workers, nurses, pharmacists, general practitioners receive shockingly limited formal dermatology training. This gap directly leads to misdiagnoses, inappropriate treatments, and unnecessary referrals. It's a massive systemic issue.
Which brings us to Section 2, the AGLS Dermatology Solution.
What's really interesting here is how the course outlines a super manageable 50-hour workload. It perfectly blends live interactive sessions with flexible, self-paced learning on a digital platform. So it breaks down into 16 hours of live, expert-led online sessions where you can actually ask questions in real time, plus 32 hours of self-paced learning through their learning management system, and then a couple of hours for testing. This means you can study high-resolution dermatologic images and cases on your own schedule, which is huge when you're trying to balance it with demanding clinical shifts.
Whether you're in primary care, an outpatient clinic, or dispensing meds at a pharmacy, this course is tailored specifically for your daily realities. It isn't just for aspiring dermatologists, not at all. It's specifically engineered to empower the entire spectrum of allied health professionals. Because think about it, when a pharmacist knows exactly why a specific biologic is prescribed, or a clinical officer can properly triage a necrotizing infection on the spot, the whole healthcare system wins.
Moving on to Section 3, Foundations and Pharmacology.
Before we tackle complex diseases, we really have to build a rock-solid scientific foundation. These first two modules give you the biological vocabulary of the skin, like utilizing the Fitzpatrick classification scale, and they give you the power to rationally prescribe everything from topical steroids to advanced biologics. Module 1 dives deep into the epidermis, the dermis, and skin barrier functions. Then, Module 2 transitions you directly into pharmacology. And you're not just memorizing drug names here. You'll actually understand skin permeability, the nuances of choosing a gel over an ointment, and the evidence-based prescribing practices you absolutely need to combat resistance.
Next up is Section 4, Managing Common Skin Conditions.
Now we hit the front lines of daily practice. Instead of just guessing, you're going to learn how to accurately grade acne severity. Use diagnostic tools like a Woods lamp for melasma, and deploy targeted, evidence-based therapies for chronic psoriasis. Modules 3 through 5 cover the real heavy hitters. You'll learn how to differentiate between rosaceous subtypes and pick the right systemic agents. You'll also get into the psychosocial burden of pigmentation disorders like vitiligo and post-inflammatory hyperpigmentation. Plus, for eczema and psoriasis, the curriculum covers vital scoring tools, like the PASI index, which measures area and severity, so you can actually track your patient's real progress over time.
The curriculum also neatly compresses the massive burden of inflammatory and infectious dermatoses. Modules 6 and 7 are all about distinguishing the imitators. Is it a fungal tinea infection or is it pityriasis rosea? Is that rash a standard bacterial cellulitis or the early warning signs of a severe autoimmune blistering disease? You're going to learn the red flags that demand immediate intervention, as well as the exact antimicrobial therapies needed to prevent emerging drug-resistant pathogens.
This leads us right into Section 5, Complex Cases and Specialties.
Module 8 beautifully contrasts the extremes of age. Children and the elderly are not just small or old adults, right? Their skin physiology is fundamentally different.
This module ensures you know how to safely adjust dosing for an infant with eczema versus an elderly patient dealing with stasis dermatitis. You'll learn exactly how to navigate corticosteroid fears with really anxious parents and how to manage the incredibly fragile, easily torn skin of geriatric patients who, let's face it, are likely already taking a dozen other medications.
For Modules 9 and 10, things get intense. You'll master the ABCDE criteria to catch malignant melanomas early, and utilize the TIM framework to confidently manage chronic diabetic foot ulcers and severe animal bites. This is literal life-saving clinical knowledge. You'll learn the ugly duckling sign to spot skin cancers hidden among benign moles. Plus, you'll dive into advanced wound bed preparation and the exact protocols for human bites, insect stings, and yes, even snake envenomations.
Finally, we arrive at Section 6, Advancing Your Clinical Career.
The path to your professional certification here is clear, and it's rigorous. It starts with a baseline pretest so you can see exactly where your knowledge gaps are right from day one. Then, after progressing through all 10 modules of interactive case discussions and self-paced content, you're challenged with a comprehensive post-test. You have to pass with an 80% to prove your clinical competence. This ensures that the certificate you earn actually holds weight and represents a true, measurable upgrade in your clinical abilities.
And here's a huge perk. Upon successful completion, the course awards more than 40 CPD points. That directly fulfills your continuing education requirements while massively upgrading your diagnostic skill set. Earning 40 points is a substantial addition to any professional portfolio. It signals to your employers, your peers, and most importantly your patients that you have a serious commitment to delivering modern, high-quality dermatologic care.
Ultimately, this structured curriculum offers a very clear path to closing the knowledge gap in dermatologic care. By giving frontline workers the actual tools to diagnose with precision rather than just guessing, the impact on global patient outcomes could be absolutely profound. It really leaves us with one important question to consider. If every single primary care clinic and local pharmacy was equipped with this level of specialized knowledge, how drastically could we reduce the global burden of untreated skin diseases?